Finasteride and Minoxidil. So these are the two big compounds people use for hair loss, with or without gear, actually. The company Hims makes their living off of this stuff for the most part. They do, well, this and Viagra, off-brand Viagra. But these are products designed to treat hair loss, and there's quite a bit of success, actually. So Minoxidil has a success rate on its own of about 60% in increasing hair growth, decreasing hair loss, and those sorts of things. Finasteride has an even higher success rate, about 85% of success in regrowing hair, preventing hair loss, and that sort of thing. When combined, the success rate jumps to about 95%. So these are highly, highly successful pharmaceuticals that particularly people who are on gear, use because everyone knows that when you wildly increase your testosterone, you start losing hair. Most people do. Most people have horrible side effects, particularly with SARMs and with when you get on just high doses of test. So I want to talk about these two compounds because I recently was just kind of curious. I saw an ad for Hims and for Roman, and was like, I wonder, what these pills they're talking about are, what compounds are in there. And of course, you go look at Finasteride and Minoxidil. So I'm going to break down what each of these does, their side effects, and my personal opinion on whether or not I would ever take them. I'm not giving someone medical advice because I am not a doctor. I am wearing scrubs, but I'm not a doctor. But I can tell you what these compounds do. So minoxidil is a vasodilator. Basically, that means it does exactly what it sounds like. It dilates your blood vessels. It opens up your blood vessels. Brings better blood flow to your scalp is kind of the idea. Now, you can get this as a topical ointment or spray, or you can get it as a pill. If you get it as a topical ointment or spray, the side effects are greatly diminished compared to the pill. It doesn't do away with the side effects, remember that. But it does diminish them to some degree. So what bad things could opening up your blood vessels like that have? Well, wild fluctuations in blood pressure. If you have high blood pressure, if you have risk of high blood pressure, your doctor generally will not prescribe this to you unless you're already on blood pressure meds, and sometimes even if you are, because allowing your blood pressure to fluctuate like crazy is a really bad idea, particularly up high. It also can cause heart palpitations and irregular heartbeat. So if you have a heart condition, atherosclerotic heart disease, any of that has been causing heart issues, congestive heart failure, those sorts of things, they generally won't prescribe this to you because it becomes dangerous. And now with this, you can even see some swelling in your legs because it can mess with your heart function. That is a known side effect of minoxidil. Also, it can, when combined with finasteride, exacerbate the effects of other drugs that are in your system. Because when your blood vessels open more, it allows faster and more efficient delivery of pretty much anything that's in your system. So all the good stuff and all the bad stuff. Now, something I always add as a side effect with medications when I'm talking about them with people, if I'm in someone's home doing med reconciliation or something like that, is pretty much no medication is good for your liver or kidneys. I mean, obviously there's liver and kidney meds that they use to, enhance the function, but none of these like generic, blood pressure, heart disease, these ADHD, depression, anxiety, all of these come with a load on your kidneys and your liver. And some of them, when taken consistently for a very long time, can cause cysts to appear in your kidneys. And I'm not saying that's true of minoxidil. I'm not actually sure. But some of these long-term medications people use, I know that heart or blood pressure meds are notorious. Blood pressure meds, anxiety, depression, and ADHD meds are all notorious for this. So what you want to do with the advice of your doctor, obviously, is safely take as few medications as possible. Obviously, take what you need to take and all that sort of thing, but you want to safely take as few as possible. Because they're unnatural compounds. They're not good for you. So that's minoxidil. Finasteride is, in my opinion, a much more nefarious drug, I guess, because while it does have the effect of restoring your hair loss and decreasing the rate at which your hair is lost, it works as a 5-alpha reductase inhibitor. What does that mean? Well, basically it means it blocks the effects of a certain enzyme. And the particular enzyme that it blocks is DHT, dihydrotestosterone. What this is an androgen that causes, it basically allows your body to break down testosterone and use it in certain ways to give you your secondary sex characteristics, so like facial hair, a man's deep voice, incidentally, hair loss, and something called benign prostate hyperplasia, which means that your prostate grows as you get older. So older men have issues with, if you ever, this is kind of a strange thing, but if you've ever had to go pee with an older guy, and you're standing at the urinal together, chances are, if you're a young guy, you're in and out of there 10 times quicker than the older guy. That's because it takes a minute for the older guy to start his pee stream, because the prostate enlarges and pushes against your urethra, and it can kind of close that opening. So a lot of older people have issues where their prostate gets enlarged to a point that it closes off and they have urine retention. So this drug, incidentally, is also used as medication for benign prostate hyperplasia. So what's bad about this? Well, several things. While it is very, very good at preventing hair loss, the side effects are kind of crazy. So particularly with oral finasteride, you're going to see a very decreased libido in a lot of people. Not always. This is side effects are never the same for everybody, but on average what you see is a very decreased libido. So your sex drive can drop to almost nothing. If you do have a sex drive, you have huge issues with achieving an erection. You get erectile dysfunction. If you are able to achieve an erection, many times you're not able to keep that erection long enough to do anything with it. That to me is kind of one of the biggest deals. But it's also known to cause suicidal ideation, depression, anxiety, different mental health disorders, and exacerbate mental health disorders that you already have. This holds true with finasteride and minoxidil both. The oral versions of these are much, much stronger with the side effects. The sprays tend to be a little less severe with the side effects. That's just a trend, but they still exist. With the spray for finasteride, you also can get an itchy, irritated red scalp. And there's, risk for, I'm sure, several other issues that I haven't discussed, but those are kind of the main ones. And once again, like I said before, liver and kidneys are always a concern. If you're running gear, your liver and kidneys are also working overtime. So when you add another compound to your stack, like finasteride or minoxidil, you're kind of begging for trouble. So here's my overall take on this. Don't do gear in the first place. But if you're going to, talk to a doctor about all of these side effects and decide whether losing your hair, do you want to do the bald and beard look? Or do you want to keep your long hair, keep your long hair and go through all of these other side effects? The sexual dysfunction is a crazy one. Oh, here's the worst one to me. If you are taking finasteride and you get someone pregnant, as a father, this one just like... if you get someone pregnant, you can cause pretty severe birth defects because the finasteride can be passed on through your semen. So if you are on this stuff or on gear and all this other stuff, make sure you're using protection, because you don't need to be passing on birth defects to someone else. It's not right for you to do that. And to me, I'm young enough. Obviously, I want to have more kids. I have a daughter right now. I want to have more kids. You kind of need to be on finasteride constantly to rebuild your hair. You can kind of stop and let it, start falling out again, or you can keep it. While I'm young, I want to have kids. I am not interested in being on a compound that could cause those kids to have severe birth defects. And there's, all these other issues, of course, as well. I also don't want to be on a whole bunch of medications, because my personal opinion on all of this is I like my liver and kidneys, and I will avoid medications that I don't absolutely have to have as long as I can. I would rather lose my hair than be suicidally depressed, than be anxious all the time, than lose my sexual function. I would rather lose my hair. I will just, when it starts to thin naturally, as it does for most men, I will cut it off, do a high and tight. And then once I start to lose it all, it's like, fine, I'll lose it. That's okay. My dad lost his hair and he's doing just fine. So anyway, I hope this was helpful. I personally would not take these compounds because, like, for me, I don't value my hair at that level. If you are going to take these compounds, be aware that these are side effects, and make sure you understand kind of the effects of what you're doing with the gear and with these particular compounds, because they'll tell you, well, you run a stack of gear, but you take the finasteride, the blood pressure meds, the such and such, you're going to be okay. And it's like, no, you're not. Your body doesn't actually really recover well from this stuff. You put more damage to your liver and kidneys by running a cycle of gear with all of these extra compounds than you would, in living multiple years of your life normally. And particularly if you're drinking or smoking or both on the side, particularly drinking. You should not drink if you're on cycle. And there's a lot of medications that when you drink alcohol and you're on these meds even, you shouldn't do that, because it just exacerbates your liver and kidney issues. Causes scarring to your liver, puts cysts in your kidneys. It's just not good. So don't do it. I know that the aesthetic is great and all of that, but SARMs in particular, a lot of hair loss issues when you get off of SARMs, and a lot of really young people get on SARMs. A lot of really young people get on finasteride. A lot of really young people get on minoxidil. And while this is effective at preserving your hair, it doesn't do the rest of your body any good. So there's that. Take it for what it's worth, and I'll see you in the next video. Thanks.